Have you ever had pain in the right upper abdomen, especially after eating greasy food, and wondered if it's our gallbladder? Well, you're not alone. Gallbladder disease is one of the most common reasons people end up needing surgery. And today I'll explain the key signs and symptoms that your gallbladder may be causing and when it's time to consider removing it. Let's simplify what's happening inside your body and when surgery actually helps. So the gallbladder is a small pouch under your liver, and its job is actually to store bile, a digestive fluid that helps break down fat. What it actually does is not only does it store bile, but it actually concentrates it. When you eat, your gallbladder contracts and releases this bile into the intestine, which is actually supposed to digest fat. But when it becomes oversaturated with fat, gallstones start to form, and the gallbladder becomes inflamed when it actually contracts with stones inside. Just imagine putting your hands and trying to grab some sharp object or even just hard rocks. It will actually start to hurt and get inflamed. The most common symptoms of a gallbladder pathology is the development of gallstones. And these are small stones, most commonly made out of cholesterol or occasionally bile. Here are the symptoms that suggest your gallbladder may be to blame. One is right upper quadrant pain, especially after eating fatty food. So if you ate something like a greasy cheeseburger, 30 minutes or shorter, you could start having pain in the right upper quadrant. Next one is pain that radiates to the shoulder and the back. And this is because of the irritation which shares with the diaphragm from the innervation on the inside. When the gallbladder gets inflamed, this visceral peritoneum covering that area shares the same sensory innervation as your right shoulder, and that's why the radiation typically occurs. Third, nausea and bloating after meals. This is something that's commonly heard when we discuss with patients on the outpatient setting that they have some food intolerance, especially fatty food. For severe attacks, some people could have vomiting. And lastly, indigestion or fullness even after small meals. Again, these signs and symptoms may actually be from other disease pathologies, but they could also be from your gallbladder. Sometimes the pain comes in waves, and we call this biliary colic. The cystic duct is obstructed. When it does contract, it's going to be trying to push against this force, which is now obstructed, and that causes an inflammatory reaction. When it's temporary, then the symptoms relieve. However, if it does get completely obstructed and the symptoms persist, then this may now lead to acute cholecystitis or persistent inflammation. And that's when the pain becomes constant and often requires surgery. When a gallstone blocks the bile duct can't flow out, and the pressure builds up, causing inflammation and pain. What we have to differentiate is typical gallstone symptoms cause obstruction of your cystic duct. However, if it does go into the bile duct, then this can actually cause other signs and symptoms, which we call cholangitis. If the stones move, the pain may disappear temporarily, but the problem isn't gone. Left untreated, gallstones can cause infection of the gallbladder, blockage of the bile duct, or sometimes even pancreatitis, which is inflammation of the pancreas, which can be serious. So when should you consider surgery? You should see a surgeon if you experience the following. If your symptoms are recurrent right upper quadrant pain after meals, which are typical, episodes of severe nausea and vomiting, pain lasting more than a few hours, fever or jaundice, you should actually see the doctor earlier rather than later because these could be something that requires emergent care, or it could be something more serious. The two things are cholelithiasis developing into cholangitis, or any malignancy that is obstructing the bile duct. If there's evidence of gallstones on ultrasound, typically as surgeons, we don't need to take them out if they are asymptomatic, unless they actually reach a threshold size, which is 3 cm, in which there is now a development or risk for cancer. In these cases, laparoscopic cholecystectomy or gallbladder removal is often the best and most definitive treatment. The surgery is done through small incisions and usually as an outpatient, and most people return to normal activities within a week. Your gallbladder plays a helpful role, but you can live perfectly well without it. If your symptoms are recurring or severe, don't ignore them. Talk to your doctor and get an ultrasound and discuss your options with a surgeon. If you find this video helpful, please click the like and subscribe button and type your comments and questions in the chat. And I'd love to answer them and check out the other videos we have. And I'll see you next time.